I want to welcome you to the Orlando Regional Medical Center Emergency Medicine Residency Program. It is my honor and privilege to serve as the program director for one of the finest emergency medicine residency programs in the country. I take great pride in our program and in the excellent professionals that comprise it. Outstanding clinical training, academic excellence, and an enjoyable and fun work environment are the pillars of the residency experience at Orlando Health.
Our commitment as a residency training program is not only to improve your education, give you that foundation of knowledge that's required as an emergency physician, but also to help you develop as a physician further by combining the sort of academic environment with the clinical expertise. We're providing you with the best opportunity to have a long career.
This program is unique because it's everything. It has academic, it has a little bit of community, a little bit of county, and I think that is what just makes it a powerhouse and what attracts most of the residents to this program.
So in having the pediatric center, the adult emergency room, and the women and babies hospital right here on campus, we're able to train at all three, and at all three within the same month.
The acuity, the best training, level 1 trauma center, great pediatric experience, and then just being with like-minded people who really want to have fun and enjoy every day at work. I think that's something that we're very proud of, is everybody has fun at work and we support each other while running this crazy ER that is constantly busy.
So one of the things that we are most proud of at our Orlando Health Emergency Medicine program is our pediatric experience. So not only do we have 1 month where the interns spend an entire month working their shifts in the pediatric emergency department, but we also have at least 30% of our shifts each month, so you get longitudinal care throughout the different seasons and different disease patterns. We are very lucky to have Central Florida's busiest pediatric trauma center, level 1 trauma center here in Orlando. So our residents get exposure to high volume, but also high acuity. So the sickest patients will come here for both tertiary care and trauma.
So in our pediatric training, we have opportunities to do every sort of procedure. Every other day, it's either the fellow or the senior emergency department resident that gets the head of the bed and all the traumas. So you're getting to do pediatric airways. If a child needs a central line, you get to do that. Lumbar punctures on newborns that come in with the fever.
Our residency program is deeply ingrained into the pre-hospital system here in Orlando and Orange County. We're embedded in every part, beginning from ground EMS, air EMS, event medicine, and mass casualty response. And we have one of the first accredited EMS fellowships in the country. We are a safety net hospital for our community, but we're also a tertiary referral center, a comprehensive stroke center, a PCI center for people having cardiac arrest or for having myocardial infarction. One of the other things that is unique about ORMC and our location here in Orlando is the 70 million visitors that come to Orange County every year, bringing us people from all over the world that come here, and we're able to care for them when they have emergent problems.
We are part of a unique research network called the Siren Network, which is an emergency care research network. Very few sites around the United States were selected to be part of this group of researchers, and we were selected. We have multiple research projects that go through this network, and we participate and we get our fellows and our residents and our faculty involved, so it becomes a real team effort to conduct cutting-edge clinical research.
The two situations that we focus on in the simulation lab are getting really good at the things we do every day, like STEMIs and stroke alerts, and also learning about things that we might not get to see very often. A perimortem C-section, or a patient who has an unusual illness like thyrotoxicosis, so that residents get the opportunity to practice those things, even if they don't encounter them in a clinical environment.
The goal of our program is not just to train excellent emergency physicians that are clinicians. We want them to be leaders in the field of emergency medicine. I think the most important difference between us and other programs is that we understand that the way people learn, what people need, change over time. Millennials are not baby boomers by any stretch of the imagination. Our program enables the trainee to have a substantial amount of input into how everything within our department is conducted, from clinical shift hours to academic conferencing, using newer techniques of group learning, off-site learning, individual learning, whatever it takes to accommodate the perceived needs of our trainees. And we give them the authority to impact our program.
I came all the way out from Oregon to Orlando Health, and I found a fantastic program with high acuity, high volume, and a place that I would be able to get the training that I needed in order to succeed as an ER doctor.
There's more of a sense of camaraderie. We're working towards the same goal. It definitely makes everybody feel more part of a team and less of a hierarchy, which has really been a great experience.
If you really want a family, this is the place to be.
Our graduates really help progress the field forward, and you see them in major leadership positions throughout the country.
Whenever I'm talking with a fourth-year medical student who is interviewing for residency, I always tell them to go with their gut, but your gut's going to tell you Orlando Health.
As you will learn here, cohesive and dedicated faculty, enthusiastic residents, a family atmosphere, and teamwork are the foundations of the program. And we happen to be located in one of the best places in the U.S. to live, work, and play.
I'm thankful I came here because I can't imagine not being a part of the Orlando Health family.